I went to Berry College for my undergraduate. Then I went to the University of Georgia and initially practiced in Nashville. I came up here in 1995. And I love this area. I'm a person that if I'm outside, I'm happy, and if I'm inside, I'm not. I don't have any children except for the four-legged version, and I have quite a few of those. And I totally understand that pet-human bond because I feel it every day of my life, so. Preventative care, we've talked about a lot of preventative care stuff. So some of the other things that are included in that, heartworm prevention, parasite control, I think those are very, very important. Fleas and ticks cause a number of diseases. We get tapeworms from fleas. Ticks can cause all those tick-borne diseases like Rocky Mountain spotted fever and Lyme's. So you should do very good parasite control with your pet. There's so many options nowadays. We have things that are good for 8 months now. I can't remember to give my dog stuff, so I choose these longer things. We have new flea and tick control that is good for 3 months. So if you have a bad memory like me, I go with those. We have monthly products that incorporate heartworm prevention, which is also very important. So I think you definitely need to get on a good parasitic control kind of routine. Heartworms are in this area. And not every dog is going to get them if they're not on prevention, but it could be your dog. And if it's your dog, heartworms damage the heart. They cause long-term heart disease. I've started telling my clients it's getting more difficult to get the drug to treat heartworms now. So in order to get it, it costs hundreds and hundreds and hundreds of dollars. So the average heartworm treatment now could be up to $1,000. That right there would have been your heartworm prevention for that pet's entire life. So preventative care is very important, and heartworm prevention and parasite control is very important because it'll prevent a lot of diseases, which thus, as we all want our pets to live as long as they can, leads to a longer lifespan. Yeah, there's different types of heartworm prevention. There's an injectable that's good for 6 months. There's a monthly, I think those are big, or a monthly pill of some sort, yes. So those are your choices with heartworm prevention. But typically most people go with the monthly version of it. There's topical heartworm prevention and flea control. There's oral heartworm prevention and flea control. You can buy heartworm prevention separate from flea control, or you can buy combination products that does it all in one. Lots of people go with that. And it really just depends on your pet. Dogs that have skin disease, I typically go with more oral meds. Dogs that don't take a pill, maybe the topical's the better way to go. In cats, they have all those also. You know, we have topical flea control or oral flea control. So there's all these options, and I mean, there's so many options now. We discuss it, what's best for your pet with your clinic.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
We have all kinds of flea control, tick control, and heartworm prevention. Some of these products here get fleas and ticks, basically. This would be an oral form. This is topical. You put it on your dog's on the back. This is a product that gets fleas and ticks for 3 months. It's actually a pretty nice product. This is fleas and ticks for 1 month. I mean, we just have such a variety. These are all 1 month products. You get towards here, this is heartworm prevention. This is monthly heartworm prevention. You give your dog a treat a month. This is heartworm prevention with flea control. Actually, this product is a combination of that and that. So it's Trifexis is just a combination of those two products. I like this one for mine. Flea and tick collars are not very effective. This is the exception. It's good for 8 months, and because I forget, this is my product on my dogs. So, and that might not be the best choice if you have small children rolling around on your dog, but there's so many choices, we can cater it to whatever your pet needs. And so these are discussions you should have at your vet clinic.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
recall on a lot of these chicken jerky. This is just something that's happened to me recently, so I'm not gonna necessarily say all products are bad, but we had that recall on chicken jerky treats causing kidney disease in dogs coming out of foreign places. I recently had a dog that went to UT, and long story short, after 2 weeks of hospitalization at UT, it was determined by the doctors at UT that it was the chicken jerky treats that led to some early kidney disease in this young dog. And these were the American-made products. So I don't know at this point if there's a recall on those. I don't know all the details. I just know that this particular patient is, has some kidney disease issues because of that. And that was at University of Tennessee. They made this diagnosis. So I'm just kind of telling owners to be careful with the treats that they're choosing. I used to say the American products were all fine, but I'm not sure now. So I think you need to do a little bit of research on that and use your own judgment on those things. All the human products that are having all these issues, in my opinion, don't feed your dogs human food and you'll never have to worry. Most of the dog treats, and almost across the board, it's a safe industry. So every now and then you'll have a recall. Keep yourself tuned in for that. But that's very rare. I know on the human side they have recalls all the time. But if you don't feed your pet human foods, then you're not going to have to worry about what the recalls in human medicine are. Human food. So personally, I think that's the way you should go. And then there's so much information online. Use your judgment when you read it. This whole online thing, I love it, but it's also not great. You gotta use your judgment or call your veterinarian. We're gonna be the first line people told when there's a problem with the product. So usually we are gonna know before you know because we'll get a heads up from our, all of our companies that we use. I also think that would bring up social media. I think you have to we're talking about choosing a vet. Find a veterinarian that you trust. Find a veterinarian that's gonna be there for your pet and you. But I also think when you're choosing a veterinarian, a couple things that I wouldn't price checking, that's great, but you're gonna get what you pay for. So I think you need to I like word of mouth. I think you should go by word of mouth in choosing a vet. And that brings up social media. When you're looking at social media, it's not God's word. Anybody can write anything on there. I think you need to be wise about how you read those because we have, I think if you're looking at any place you go to, whether it's your car dealership or your veterinarian or, your doctor, one negative review and 100 positive reviews, I think you have to use your judgment on the negative. So I just think you have to choose your veterinarian wisely, and including being wise about how you, read all these comments and stuff. And so just kind of be smart about it.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
This particular diet has a product in it that maintains a certain pH of the urine, and if you maintain a certain pH, depending on the disease, it will try to prevent infections. It'll prevent the formation of stones. So this diet does that. This diet is like a sensitive diet for skin disease. It is a diet that's processed so that the cat won't have a reaction to it and have itchy skin, or it's usually meant for skin allergies. So that would be that diet. If your cat's fat, that's a really good diet right there to lose weight on. It stands for reducing diet. My dogs are on WD. Well, that's a cat version, but let's see. My dogs are on this one. I told you my dachshunds gain weight on any over-the-counter diet, and so I have to keep them on this. This is a low-fat diet to maintain proper weight. This would be for stones. Once again, there's multiple diets for stones. This one is my favorite. Where is it? Okay. This one of the most common older cat diseases is hyperthyroidism. We talked about it earlier, where cats have an overactive thyroid. And if you have a single cat household, you can actually feed them this food and control the disease with just food. So it's actually a diet that would control a disease like that.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
Every dog food will have the ingredients listed in it, and every dog food will have usually all the components, the carbohydrates and the proteins, and that might make a difference in which one you choose. Because, yeah, there's definitely, I would read the protein and carbohydrate and fat levels, because depending on your pet's health or stage of life or whatever they're going through, it might matter. Or diseases they may have, definitely that would make a difference. So I don't think we see it as much. I think there's some trends going towards homemade diets, and I mean, that's fine, but you've got to make sure you do a well-balanced diet. So we do have some options, and I would talk to your vet about that. There's some of the trends that are in human field we're seeing in animals, but in my opinion, most animals do fine with just a general diet. I mean, you don't really need to go get these crazy fancy diets in most cases. There are reasons for that. There's reasons for an $80 bag of dog food, but you really need to, there's got to be a medical reason for it. And most dogs don't have those problems, so, or cats. There's a few things in our career as a veterinarian that I can do the most to help your pet, okay? Physical exams, I think, are important. Good dental care, basically preventative care. It's a preventative care package that we want to do. We want to prevent your animal from ever becoming sick, and we want to prevent illnesses if possible. So what we do is a full exam, and dentistry becomes an issue. Dental care has been proven to increase the quality of life your pet has and the quantity of life. You can actually live longer with the dental care, because that bacteria causes pain. It affects the heart, the kidneys, everything, the lungs. And good dental care improves quantity and quality of life. So I'm a big believer in dentistry. It's one of that, vaccines, spay, neuter your pet, yearly exams, heartworm prevention. These are all the things that will allow your pet to live longer. So I'm a big believer in taking good care of dog's teeth. And your veterinarian can discuss things you can do at home also to help do that. So that's a big area. The chews at Walmart, greenies, I like the greenies. We sell one here that's actually probably a little more brushy effect. So all the stuff you can do at home is important. And everybody always says, I brush my dog's teeth. Well, that's great, and you should. But I brush my teeth every day and floss every day, and I still go to the dentist to have dental care. So what we do in a dental is we scrape the gum line. We get all the tartar off. It's no different than your dentist, going to your dentist. So we get rid of all the stuff under the gum line. That's the part that is actually the most dangerous to the pet. If there's any extractions that need to be done, we would pull the teeth. So basically it's a full dental, and you can't do that at home. And obviously we have to sedate these animals to do this, but the sedation is very mild, and they do great. So many people are scared of anesthesia. That's actually a topic to bring up. Anesthesia, if your pet is healthy, is so little risk that the dental disease is a lot worse. So I always tell my clients with anesthesia, it's so safe today. I mean, the drugs we have are the drugs they use in human medicine. We have monitors on these pets. In 22 years, we just never lose pets to anesthesia if they're healthy. So don't let the fear of anesthesia stop you. I mean, I hate to say, knock on wood, but we never lose pets to anesthesia. So I just try to get people over the fear of that to let me do the proper care for their pets. If dogs would open their mouth and let me clean their teeth without it, I'd do it that way. But unfortunately, they're not quite as, they're not as nice about that. So definitely schedule good dental care with your veterinarian. It's important. I always look up green dog bowl is one. I mean, there's all kinds, but this is the one my dogs have. So that's the one that I feed my dogs out of. That's just an example. There's all kinds of examples. This is one, my older Doberman has this one. He has, the other bowl, it slows my young Dobe down to about 20 minutes it takes him to eat his meal. This is about 10, and I've discovered my older Doberman can't stand for 20 minutes to eat. So I chose that one for him because it takes him about 10 minutes. But just pick the bowl, but all of these are just ideas on how to slow your dog down. Yeah.